Hi, today we'd like to discuss another important topic related to women's health and fertility, which is endometriosis, another common gynecological condition next to PCOS in how common it is. So popular to contrary belief, endometriosis does have an effective treatment method, and you can actually recover from this condition without going for unnecessary treatments, and also you can achieve your fertility goals, especially here at Antai Hospital. So do stay tuned to watch the entire video. So endometriosis, if you are familiar with this condition, it is the condition where your endometrium tissue, the tissue that lines the inner layer of the uterus, where implantation always occurs, and also where during your menses, your menstruation cycle, this is the tissue that vascularizes, thickens, and then sheds if there is no fertilization and implantation. This is the tissue that sheds and leads to the bleeding that you observe every month. So for this condition particularly, this tissue is being displaced and growing in abnormal locations, and it's not limited to the reproductive system as well. It can grow in several locations very far away, and some, in rare cases, we have found it to be displaced onto your kidneys, your diaphragm, your muscles of the upper pecs, several locations in your digestive systems, and several peculiar locations. However, the more common ones that we observe, the more common cases is that these tissues are displaced nearby. For example, outside of the uterus, on its muscle walls, on the outer layer, on the fallopian tubes, and also another common location is inside the ovaries. So these tissues, because they still carry the ability to vascularize, thicken, and then shed every month according to the fluctuations of your hormones, they still bleed regardless of their location. This is why it can lead to distinct extreme menses pains. So if you do know anybody experiencing menses pains, it may not exactly be endometriosis, because other conditions can also cause menses pain, but it is most commonly associated with endometriosis. So it is something that you do need to get checked, go for your doctor's appointment, and don't just blindly endure it and believe that it is normal to experience such extreme pains. It is not normal. You should only experience mild cramps, nothing that can affect your daily activity, nothing that can actually cause you to be unable to engage in normal activities. You should be able to live out your life as normal as possible. Anything that's causing extreme pain, get checked. So if they are situated within the ovaries, they can become what we know as chocolate cysts, another common condition. It is also part of endometriosis. Why we call it chocolate cysts is because these tissues are now inside the ovaries. The ovaries are supposed to be white, but because they accumulate over time, they still bleed. This blood will become reddish, brownish in color, causing this the cyst, the tissue, to become chocolate in color. That's why we call it chocolate cyst. So as I mentioned, the first symptom, distinct symptom, is extreme menses pain, severe menses pain. Another one is you do experience pain during intercourse, another common symptom that we associate with endometriosis. So if you do know that you're observing these two, you can self-diagnose that it's possible that it is endometriosis, but it is important to go get the proper examination. At Antai Hospital, examination for endometriosis is done via pelvic examination, vaginal ultrasound. The gold standard is, of course, using laparoscopic diagnostics, because there is direct visualizations. Our doctors want to physically see these displaced tissues so that we can actually remove them, which is treatment. At Antai Hospital, our treatment for endometriosis is not just painkillers, which is the common management method. Some hospitals even recommend hysterectomy because these women are unable to see effective treatment and they are experiencing terrible menses pains monthly, so they would just rather remove it. At Antai Hospital, we offer you another alternative where you can keep your uterus, retain its function, still get pregnant, but you can still recover from this condition. So for this surgery, the treatment goal is simple. We need to pinpoint the location of these displacements, which we can do through diagnostics, where we will use a bunch of imaging techniques, diagnostic techniques to pinpoint the location. And now our surgeon will use 3D laparoscopy, a minimally invasive surgery to remove all of these displaced tissue effectively, and also in a one-time clean surgery with no remaining tissue behind, so that we can avoid future recurrence. We want to avoid future recurrence. We want this surgery to be only a one-time effective surgery. And many hospitals cannot achieve this because they do not have experienced, highly skilled surgeons who know exactly where these tissues are pinpoint located, and also it really needs some experience to do it properly so that we can avoid recurrence. And at Antai Hospital, we do have over 2 decades of experience in dealing with endometriosis and other conditions that can cause extreme menses pain. So once these tissues are removed completely, and not to worry, you won't have any scarring because this is a pinhole surgery, a minimally invasive surgery, and there will be no post-adhesive scarring, adhesions, or any pain that you can anticipate. Rest assured. And upon full recovery, you can realize that you will no longer have the extreme menses pains because the tissues have been displaced. And furthermore, you can now achieve your fertility goals without any complications. Now that is our ultimate goal here at Antai Hospital, because we want to ensure that you can get pregnant naturally and start a family. So do share this video to those who are experiencing endometriosis and are going for those ineffective treatments, for example, medication, and also unnecessary surgery such as hysterectomy. This video serves to educate you and show you that there's another alternative surgical approach that can achieve recovery and also help you attain pregnancy. So get in touch with us via the website, and also leave me a comment down below for more other topics that you would like us to discuss.